The purpose of this presentation is to provide immunization augmentee training and is geared for a state mission in support of the COVID vaccination program. Normal immunization augmentee training prepares airmen to immunize other healthy airmen. However, this presentation aims to provide an increased awareness and comprehension of varying situations and unknown patient health disparities that accompany mass immunizations. So, the outline for this will be basic immunology, vaccine administration, cold chain management, dose, route, site, needle size, emergency procedures, and COVID specifics. Basic immunology. To immunize means to render immune or resistant. Immunization or vaccination has been around even before we knew about infection or immunology. In 590 BC, inoculation of smallpox was used as a protective measure in the Song dynasty of China. Deliberate inoculation of smallpox as a protection against natural diseases was also used in 1721, but most famously by Edward Jenner, who is considered the founder of inoculations when he vaccinated a 13-year-old with the variola vaccination or cowpox, which is a cousin to the smallpox. Even Buddhist monks used to drink snake venom to create an immunity from snake bites. So some of the terms, we talk about immunity. Immunity is the ability of your body to tolerate the presence of an indigenous, meaning itself, material, and to eliminate foreign or non-self material. Antibody protein molecules or immunoglobulins are produced by B lymphocytes to help eliminate an antigen. Antigens are substances that are capable of inducing the formation of antibodies. Then we have active immunity and passive immunity. And within each of those, we have natural and artificially acquired. So naturally acquired active immunity occurs when a person is exposed to the live virus, meaning you are exposed to the chickenpox, you get sick, now you have immunity to it. It lasts longer, and so that's one of the benefits to it. Artificially acquired active immunity occurs when we administer a vaccination. So we have a vaccination against the chickenpox, so we can give that to people and children and adults so that they don't get the chickenpox virus. Now, that one sometimes doesn't last as long, and it's not as strong as an immunity. Naturally acquired passive immunity, that occurs during pregnancy. So antibodies are passed from mother to baby through the placenta. And so when the baby is first born, it has some immunity. However, it's short term, and that's why we encourage moms to get vaccinations shortly after and start once the baby is about 6 months old. We also immunize pregnant mothers with Tdap, or the tetanus, pertussis, and diphtheria, and a flu shot so that baby is covered upon birth. Artificially acquired passive immunity, now that's a short-term immunity, and it's typically given through immunoglobulins or gamma globulins. Now, during Desert Storm, or right before, all of the airmen that were going overseas were given gamma globulins to protect them against unknown processes or diseases out there. So how immunity works. So we talk again about the self and the non-self. So it's important that our body recognizes this. Immunity is indicated by the presence of antibodies or immunoglobulins or IgG. This is the most common antibody. Immunoglobulins, or IgM, are found mainly in blood, lymph fluid, and this is the first antibody the body generates when it is fighting a new infection. So sometimes, for example, with the Lyme's disease, we will draw either an IgG or an IgM, depending on if we thought it was an older uh, exposure to Lyme or brand new. And so it's important that we know those things when we're talking with our patients to understand a little more about the IgM or IgG. Um, so, herd immunity happens when a large part of the population, the herd, is immunized to a virus or becomes immune to the virus. This occurs either because people got vaccinated or they got sick. Herd immunity can retard or slow the spread of the virus, providing a degree of protection to those who have not been sick or vaccinated. Herd immunity or community immunity is not possible if enough of the population harbors contentiousness or they object to vaccinations, or they're traveling to countries that do not vaccinate. There are a lot of countries over there that don't practice vaccination. The problem with herd immunity is that, well, yes, it's great if we could all get sick and be the one that's asymptomatic. However, it's really impossible to predict who will get the serious infection that can lead to hospitalization and who's just going to have a mild case. It changes. We're going to talk about that actually in just a minute. Changes to viruses that can happen when we're not staying consistent with vaccination processes. So these are viral mutations, is what we call them. You can have antigenic drifts or small changes in the mutation in genes. So if you think about an antigenic drift, think about, we are used to seeing all of the airmen in uniform. And if you see somebody out of uniform in civilian clothes, you may not recognize them because it's just a small change in their clothes, not necessarily something huge. Now, an antigenic shift is an abrupt, major change in the virus, resulting in new proteins in the virus that can affect humans. Now, with that, you think of maybe a person who's changed their hair color, lost a lot of weight, maybe had some plastic surgery done, has completely changed their wardrobe. So somebody you knew before, you don't know now. And so that's how it works with the body. All of a sudden, it sees these mutations that can cause us not to recognize the virus, and therefore our bodies don't start to attack it, and we can get sick with it again. The flu vaccine is one of those that has had changes. And we're starting to see that again with the measles as well, coming over. Antigenic drifts or shifts, is something that we see, for example, most people have little to no immunity against these new viruses. That's what happened with the novel coronavirus. This virus had previously only infected animals and somehow jumped or shifted and is now infecting humans. And so that was a shift that was very serious and changed drastically the dynamics of this virus. Vaccine administration. So when we talk about vaccines, we look at different classifications. So vaccines come in all different kind of shapes and sizes and colors. And so live attenuated vaccines can also be viral or bacterial. They can be derived from wild disease-causing bacteria, or they can be attenuated, meaning they're kind of a weakened form. Then there's the inactivated. Now, with the inactivated, we're looking at taking a virus. So viruses kind of look like spiders. They're sort of weird-looking things. And they can either take that whole virus or that whole bacteria and kill it, or they can just maybe pull off a little part of it, maybe pull off the legs, and use just the proteins like that, or just a subunit of it. Or they'll take maybe the polysaccharides, what makes it kind of hold together. And some even do recumbent vaccines, are also used commonly in the United States. So inactivated vaccinations are produced by growing the bacteria or the virus in a cultured medium, and then inactivating it using heat or chemicals. Oral typhoid is an example of a bacterial vaccination. So we do kind of have both of those. And the measles vaccine that we are using even today was isolated from a child who was sick with the measles in 1954. That virus can be very fragile and has to be stored and handled very properly and within strict guidelines. Inactivated vaccines almost always require multiple doses. The first dose is sort of meant to prime your system and kind of get it ready. And then the second dose is what really ramps up that antibody producing effect. So, properties of vaccines. There are a lot of ingredients in vaccines, and each of them serve a particular purpose. They provide immunity or protection. Some of them keep the vaccine safe and help with them to last longer. Some are used for the production of vaccines. And this is why we ask about all allergies, like eggs and sugar, gelatin, neomycin, even aluminum formaldehyde. All those things can be part of an immunization. And so what we want to do is always ask, do you have any allergies? And if they're not understanding the question, you can ask them if they have allergies to food, bugs, plants, medications. So we want to know all of those things. And then you can go to the excipient report, and that will tell you. So preservatives are used to prevent contamination. We use adjuvants to help boost the body. That's what really gets your body agitated enough to make or create a response. Stabilizers are used to maintain the vaccine potency. And then we have residual cell cultures. So maybe there might be a little bit of that still in the vaccine, and some inactivated ingredients as well that are in there from the processing part of the vaccine. And they also might put some antibiotics in there as well. So this is what an excipient report looks like. I just put I just screenshot one page, but you can go and look any vaccine up and it will tell you all the ingredients in it. And in addition to all of these ingredients, some of the things are used in small amounts, and some are used larger. Preservatives like Thermosol, and that's one of the ones that's the big controversy with Alzheimer's, not Alzheimer's, but autism. However, that was disproven by a lot of really good scientists. You can read information on that. But they prevent contamination. We put adjuvants in there, like I said, to create a stronger immune response. For example, aluminum salts, that's an adjuvant, that's there to irritate. Then we have stabilizers, which are used for transportation and storage of the vaccine. And those can be things like sugars or gelatin. And then there's other residual trace amounts of material, again, that could be used in the manufacturing process or in the cell culturing process, like egg protein or other kinds of media, culture media. And then there's inactivated ingredients that are used to kill the virus or inactivate the toxins, such as formaldehyde. So you really want to know what kind of allergies people have. Now, our role as the healthcare provider, studies have shown that a strong recommendation by their healthcare provider is a powerful motivator. Even people who are reluctant when their healthcare provider says, you really should get this vaccine, they're more motivated. Discussing the benefits and the risks involved in the vaccination are also something that you really want to talk about with your patients as well. Providers are required by law to distribute a vaccine information statement or a VIS before each dose. This emergency use order that's gone out right now for the COVID has excused this requirement, at least temporarily. I'm sure we're going to have a vaccine information statement at some point in the next year for the COVID vaccine, but at present, there isn't one. You also want to screen for contraindications and precautions. Do these people have diabetes? Does this person have Parkinson's disease? Are they receiving chemotherapy or radiation therapy? Do they have allergies to antibiotics? You want to know these things and know what's in your vaccine so that you can save them from having a possible allergic reaction or adverse event. Share information. So you want to share reasons why the vaccination is good. I mean, clearly with the flu and with the COVID virus, again, we just can't predict who's going to get sick and who's not. So it's really important that we share that information with them, that it's really a good thing. The doctor that I work with always says that, we buy car insurance not because we're waiting to have an accident, but we buy it as protection against, ourselves from getting into trouble if we get into an accident. It's just a protective measure. So same kind of thing when we're thinking about vaccinations. You want to highlight positive experiences, either personal or in practice, things that might be appropriate, because you want to reinforce the benefits and strengths of the vaccine. Address any questions or concerns that patients have. If they're worried about the safety or the side effects of the vaccine, maybe they don't quite understand the language that's written in the vaccine information sheet, or they're just having difficulty. You want to help them out with that. Explain the potential costs of getting the disease, including serious health effects and how it can affect them missing work or family time or even financial costs. And you want to address any barriers to their psychological questions. Did they have a previous bad experience? We want to know those things. So contraindications, there's also other lists, as you see here, that can tell you what contraindications there are for different vaccines. And as well, we're going to see these with the COVID vaccine too. In the manufacturer's package insert, it should have what the contraindications will be for that vaccine. So we're going to want to make sure that we watch for that. Also, um, Also, know the contraindications for a vaccine that you're given. Seek answers to patient questions, if necessary, by calling 1 800 GET VAC or asking one of the providers that are working with you. Or you could read the package insert provided with each immunization. Barriers to vaccination. So, there are a lot of barriers to vaccinations. Some people are worried about access to healthcare or don't have access to healthcare. Um, Multiple competing priorities for the providers. Sometimes we're just so busy with all the other things that we have going on, we just don't have the time to sit and educate our patients on the importance of vaccinations. So, we really need to make sure that we take the time or set aside specific appointments for that. Low awareness among adults about recommended vaccines and their benefits, and then challenges in coordinating care for adults who often have more than one medical provider. A complicated adult immunization schedule can also cause patients not to want to get vaccinated, and cost and reimbursement is huge. People really can't afford a $400 vaccination. For the COVID vaccine, though, payers will be paid by Medicare and Medicaid, private insurance, and there will be federal reimbursement for those who don't have any of those types of coverage. Patient records are also going to be really important to the medical practice. Years ago, we used to use the yellow shot records. I'm not sure if we're going to be using those again, but an immunization needs to meet all of the applicable legal requirements, as well as requirements for any specific program. So we'll want to know what all of those are as well. What is cold chain management and why is it important? Cold chain management is maintaining storage and temperature requirements of various vaccinations. It's very important because vaccines are very expensive and you want to make sure that you're maintaining them at a proper temperature. Vaccines must be stored properly from the time they're manufactured until the time they're administered. Potency is reduced every time a vaccine is exposed to an improper condition. This includes overexposure to heat, cold, light, and at any step in the cold chain, it can really reduce its potency. And once the potency is lost, it cannot be restored. So, all staff members who receive vaccines deliveries, as well as those who handle or administer vaccines, should be trained and be familiar with the storage and handling procedures. The biggest elements that we rely on is a well-trained staff, reliable storage and temperature monitoring equipment, and accurate vaccine inventory management. The result of cold chain management can be really costly. For example, the vaccinations that we have at our facility can range from $7,000 to $14,000. So it's a big responsibility to maintain those temperatures. Temperatures are maintained in the refrigerator. Temperatures should be maintained between 2 and 8 degrees Celsius, and that's how we record them. We keep them in Celsius. Freezers should be maintained in temperatures between minus 50 and minus 15. Now, you may have heard a little bit about the COVID vaccine that's coming out by Pfizer, and it requires these ultra cold freezers. That is because most freezers do not go below 30 to 40 degrees, minus 30 to 40 degrees Celsius. So, and this has to be maintained at minus 60 to minus 80 degrees Celsius. So I'm not sure if we're going to have those. You might see them in the community. So just be aware that that is something that you may see. Now, when we are recording and maintaining these temperatures, there's a couple of things that we need to know. So one, you want to always make sure that you are using a digital data logger. And that's what you're seeing right now on your screen. And that shows a minimum temperature, a maximum temperature, and the accurate temperature. Also should have an alarm system on them. You also want to make sure that you're transporting vaccines in mobile coolers. You'll need a cooler that can, if you take them out of the refrigerator or freezer, you want to make sure that you keep them in a cooler that can maintain that temperature. And you're going to need to check the temperature every hour if it's in a cooler. If it's in a refrigerator that has like electricity and a blower and it can maintain a temperature, you only have to check it at a minimum of twice a day. So some of the coolers you can use that are specially made for vaccines are things like the VaxiCool or VaxiPack. We have those at our base. Also the AccuTemp, and that's another type that we also have, and a BioFridge. Now that's a refrigerator that can it has its own temperature monitoring system, and it is able to run on batteries or a generator. You want to document any type of temperature excursion. For example, one time I came into the base and the freezer door was open. It had gotten knocked open by too many freezer packs in that freezer. So what I had to do was take the freezer packs out and shut the door. But I documented that. I documented the time, the date, the temperature, what had happened, how long it had been like that, and what I did to correct it. So those are all the things that you need to document when you're documenting those changes in temperature. Data, the digital data loggers too, you want to make sure that you have a buffered probe. You don't want to just use those metal probes. They're not as reliable in monitoring the temperature of what the vaccine or the liquid would be like. So we use buffered probes, and they might have glass beads, they can have sand, they can have glycol or Teflon in them. So those are the ones that we want to use, and we want to keep them and again, check them at least twice a day. Now, in your storage facilities, you should never, never, never put any kind of food or beverage or biohazard in with your vaccines. So vaccine refrigerators are used strictly just for vaccines. You don't want to store them in any kind of dormitory style or bar style either, because they have those ice making and freezer compartments and plates. I mean, any of you who's bought a salad, who stayed at the hotels, knows that your salad will probably freeze. So you want to, those aren't really good at keeping temperature and can really put your vaccines at risk for freezing. But note that not all small freezers are dormitory or bar style units. They might be compact, and the purpose built. There are some that are compact and specially made for biologics. And so those are okay to use. And again, you want to check those at a minimum of twice a day. This is, again, just talking about checking your storage unit, knowing what your minimum and maximum temperatures are, and recording anything that might be out of range. You want to document all that. Make sure too that when you are keeping your vaccines, that you're keeping them in their original storage pack. You want to keep them in their original packaging. You want to make sure that immunizations, checking expiration dates, and moving some of them forward if they are looking like they may expire. You want to make sure that your refrigerator is maintained at all times. You don't want to have a freezer with 4 inches of ice built up, because it's not going to maintain the refrigerator or the freezer at a really reliable temperature. So you want to make sure that you keep the seals clean. You want to keep the coils clean. If you are working in the community, make sure you're not out in an area where there's dust or it's getting wet from the snow, and that could damage your equipment. So always make sure of that and test your backup equipment. At the base, we do have a backup alarm, and we do have a backup generator for our units. So you want to make sure that you're using those. Also, you want to make sure that you are looking at the expiration dates and know what the expiration date is for the items and that you're using. Some of them have expiration dates where you can just use it, the same one that is on the vial. And sometimes the expiration date depends on when you open it. So that's called a beyond use date. For example, tuberculosis. So if I open the vial that has the PPD in it, it has to, one, be kept in dark. So I want to keep it in its box all the time. But it's only good for 28 days once the cap has been taken off. So even if the expiration date isn't until next year, that vaccine is only good for 28 days from the time I take that cap off and stick the first needle in it. Now, there's other vaccines and multi-dose vaccines, for example, like the anthrax vaccine. That one is good until the expiration date. So I need to know what the expiration date is and keep track of it, but I don't have to worry about a beyond use date for that vaccine. So you want to know those things. And again, that will be in the package insert as well. Now, when you're transporting vaccines, we talked a little bit about the coolers, monitoring those coolers every hour. And you only want to transport enough for 8 hours. Again, you don't want to take 100 vials out and only use a portion of them, and now they've lost their potency. So you only want to transport what you're going to use in that time frame. Never transport any partially used vials. So like a multi-use vial like the anthrax, if it's already opened and there's only a couple of doses left in it, just leave it at home. Leave it back in the storage and take unopened bottles. Ensure that you have proper supplies with you. If you don't have enough needles or enough alcohol swabs or syringes or tourniquets, well, you don't need tourniquets for this, but you want to make sure that you have the supplies you need: hand sanitizer, Band-Aids. And then you want to transport diluents with their corresponding vaccine. And we're going to talk a little more about diluents in a little bit. Transport vaccines in the proper temperatures. Again, you want to, in containers to maintain, use your temperature digital data loggers. Make sure you have those and identify any excursions that happen. If you have to go to an off-site facility and you're transporting these in your personal vehicle, make sure that you cool your vehicle down or heat your vehicle up prior to putting the vaccines in. If it's a really hot day and you put your vaccines in there, it could ruin the potency of them. They could get too warm. Same if it's cold and you keep your vaccines in the car. If it's too cold and they freeze and they're not meant to be frozen, you're going to ruin the potency of that vaccine. So you want to make sure, don't put them in the back of a truck, in the bed of a truck, or anywhere where the temperature just can't be maintained and regulated. Avoid leaving containers in direct sunlight. So even on these cold days, if it's a sunny day outside, don't leave it necessarily inside of your car, because the temperature in your car could raise to a level that could ruin the potency. So again, check for guidelines for transport of these vaccines locally. Okay, now we're going to talk about dose, route, site, and needle sizes. So, things you want to make sure when you're doing vaccinations, you want to use good infection control, making sure you're cleaning the area off with alcohol, and making sure you're using good hand hygiene. You're not prepping your vaccines on a dirty table, um, that you're cleaning the topper of your vaccine, that you're inspecting the vial for any kind of contaminant or particulate matter. Checking the expiration dates. You don't want to give anything that is outside of the expiration date. And again, hand hygiene and glove wearing. And if you're doing COVID vaccines, on top of all that, you're going to have your mask and your face shields and your protective outer garments and gloves. So you're going to have a lot on, and it's going to be a little more difficult and a little more challenging. So this is where practicing and using really good technique and slowing down to ask the appropriate questions is going to be really critical. So you never want to enter a vial with a previously used syringe. So for example, you go into take out some flu out of a multi-dose vial. There's not enough in there. So you throw that away and then you open up a new one. You don't want to use that same needle. Throw everything away. You want to start over. Never mix different vaccine products. So you can't just make your own cocktail combination. If they're due for typhoid or for anthrax, you can't mix anthrax and typhoid. They have to go in two separate needles. Never transfer vaccines from one syringe to another. These pre-filled syringes, you can't just assume that you can squirt it into another syringe. You don't want to do that. Never combined partial doses. Sort of like the example I was giving before. You go to draw flu out of a multi-dose vial. There's only 0.2 and you need 0.5. You can't use that. You have to dispose of it. You can't pull 0.2 from one vial and 0.3 from another to make 0.5. It all has to come from the same vial. Once the syringe is filled, you want to label it. This is really critical if you're doing a mass immunization process like a mobility line where airmen are getting multiple vaccines, maybe 3 or 4. They all could look alike. They're clear. A lot of times vaccines don't look much different. So you want to make sure that you're labeling properly. And I know you're working as an immunization augmentee where you may only give one, but we may ask you to help draw that one up and we'll need to know which one you're drawing. So make sure that you always label vaccines. Now, vaccines come in single-dose vials, multi-dose vials, and manufacturing pre-filled vaccines. So in multi-dose vials, you typically contain some kind of preservative to help. So that would be something like your anthrax. There are going to be some COVID vaccines that are multi-dose vials. Make sure that you are aware which one is single and which one is multi-dose. As you can see on the single-dose vial, do you see where it says 1 dose? That means that there's one dose. It's a single dose use. And this particular one, the MMR, that we're showing in the single dose is one that you have to reconstitute, meaning that live virus has been freeze dried into a little tablet. We have to add a specific amount of diluent that is specially made to work with that particular vaccine and to reconstitute it. And then we see the Twinrix. That one's in a manufactured pre-filled syringe. And those are often come to, and they make it a little nice when that occurs. So you want to make sure that you are drawing the maximum number of doses out, checking the expiration dates again, and that you look to properly use them. If you have any questions, you can always look at the storage guide or the manufacturer's directions. You always want to check and make sure that you have the right vaccine before you open it. Again, once you pop that cap off, that vaccine is no longer good. So always make sure that you look at your vial before you pop the cap to know what you have. Um, Always check the integrity of the vial. Check for the clarity or particulate matter. Now, the anthrax has some particulate matter in it. And in fact, you're supposed to gently agitate it prior to using it. Same with when you are reconstituting. You're going to not vigorously shake, but you're going to want to gently roll it or agitate it prior to use. You want to verify that you're using the correct lot number and expiration date, and you want to know that you're going in the right route. Now, the route is written on a lot of the vials, so you can look on there. But there's sheets also that talk about whether it's an intramuscular or a subcutaneous. There are sheets that talk about that. So make sure that you know. And then discard any unused vials or any pre-filled syringes that have been opened. So if you're doing a mass immunization and you have pre-filled, don't open up 100 of them and stick a needle on them, because those will be no good at the end of the day. You really don't want to pre-fill or open up more than maybe 10 in advance at a time to minimize waste and loss. Now, the 5 routes of vaccination administration. So you can either get an immunization subcutaneously, which is in the fat. We usually use the back of our arm. You can get it intramuscularly, which is in the deltoid. That's this part right here. Intranasally, we used to get that with the flu vaccine that came that way. Or orally, some are little things that you drink. And intradermally, we see that with the tetanus vaccine. And the methods in which these are used are usually always actually set by the manufacturer based on how it will be absorbed and how it will be used. And you want to make sure that you're using the right vaccine to make sure you're stimulating the adjuvant injected into the right area. You know, they're made to complement or agitate or stimulate a response based on where they're given, and that's all been predetermined. So again, if in question, always look. There's sheets that talk about what vaccines are given, where and how. Also with the COVID, the manufacturer guidance will tell us. And don't assume a one size fits all. While the guidance will say for an intramuscular that you want to use 1 inch to 1.5 inch. If you look at the baby and look at the young woman in the middle, I mean, clearly you're going to have to adjust it. So even though you might go intramuscular in all 3 of these, they're all 3 going to have different sizes, and based on the anatomical site, based on their age, based on their height and weight. So you really want to know what size needle is going to be the most appropriate and what gauge for these different people. This is kind of an example sort of set with the needle lengths and the sites and the in the size needle as well. So you can kind of use these, but this really is more for awareness than, rather than memorization, since you most likely won't have a choice in the needle that you'll be using if you're doing these state-funded COVID vaccination, mass vaccinations. But just know that there are different sizes that can be used. And then we'll go and talk a little bit more about some of these routes. So we had talked about subcutaneous. It's a little bit deeper because we're going into the fat. We've got to, we can manipulate in there. You can go larger volumes into the fat. Needle lengths are a little different, and different sizes because we're just kind of getting right in there into the fat. Now, with intramuscular, that one really goes deep because you've got to get past the fat and into the muscle. And now I know some men don't have a problem with that, but some of us have a little more pudgy arms, and so to get into the muscle, we have to go. We use intramuscular most frequently because it's a rapid absorption. There's large numbers of blood vessels within the muscles, and we're using our muscles a lot. So most of the time, it's the intramuscular injection. Subcutaneous has less blood supply, and therefore the response is a little bit slower. And so it's not necessarily used as frequently, but there are certain medications or certain vaccinations that it is more desirable for. Now, you do want to know if you have some patients who don't have a lot of padding, finding a little fat can be really challenging. So you have to get creative and kind of look into different areas of the skin. Intradermal, that goes right underneath the skin. And when you're giving that, you're almost going parallel with the arm because you're just putting that little bleb in. And intramuscular, you're going 90-degree angle, so straight in. And then for subcutaneous, you're going more at a 45-degree angle into the fat. So you want to make sure that you are assessing the correct site, because once you administer this vaccination, you cannot take it out. Once it's there, it is there, and it could cause an adverse reaction. So make sure that you are doing all of your screenings. You are making sure that you have the right medication or the right vaccination, making sure you have the right route that you're going to go in, the right needle size. It hasn't expired. You're using the right diluent. So those are all things. If there is any doubt, you should really stop and discuss that with one of the providers. This shows examples of kind of where we give these two immunizations, the subcutaneous and the intramuscular. One thing I want to talk about is Cerva. It is actually one of the biggest preventable things that occur or injury that can occur when giving a immunization. It's also very unreported. So what Cerva is it's a shoulder injury related to vaccine administration. And again, it's preventable. It can cause a big problem with people who do have it. They can have a lot of pain, decreased range of motion, decreased quality of life. And so what happens actually is that the vaccine is injected into the shoulder capsule rather than the muscle. So again, we're thinking of the deltoid muscle goes up here. So what you want to do is find the bone right here in your shoulder. You want to put 3 fingers down, and then you can go underneath it. That's a big chunk right there. That's about 2 inches that you have to work with. You don't have to go really high up into the shoulder. And I think some people think that that's where the deltoid, and again, it does kind of come up and over, yes. But you run the risk of injuring that person in the shoulder if you go too high. So again, find your bone, your landmark, use your 3 fingers, and then you want to go underneath. That's where you want to do your intramuscular injection. And so that can also you can damage muscles and tendons. So giving immunizations is really serious, and you need to be aware of that. People also can get cellulitis in their arms from immunizations. They can have lumps or scarring due to immunizations. You don't want to cause those for people. You want to really make sure that you know where you're going and using the right sites. Now, vaccines and reconstitution, it is likely that the vaccine that we use for COVID is going to be one that has to be reconstituted. Now, that means that it's been freeze dried and it requires some liquid added to it to make it back into a vaccine or into a form that we can inject into people to help them. So, you always want to make sure that you're using the specific diluent that came with the specific vaccine. So, there are certain elements and certain ingredients in each of those diluents. Also, know what the amount is. For example, smallpox, the diluent for the smallpox has some added stuff to it. So you can't use that one with yellow fever or with varicella. You can only use it with smallpox. And they give you like zero point 0.7 mils of fluid. You only need 0.3. So you want to make sure that whatever you're doing, you know how much is needed, because you don't want to just assume that you have to drop all the fluid that's in there and inject all the fluid in. Know how much you need for each one and how much you need to draw out of that vaccine. And again, that will be in the manufacturing papers that come with those. Most diluents, you don't want to freeze diluents. Most of them can be kept at room temperature. Clearly, a frozen icicle of water can't be put into a frozen tablet. So you don't want to freeze your diluents. Plus, it could affect whatever added ingredients are in there. And you don't ever want to use a expired diluent either. And you want to be careful, because a lot of vaccines, once they are drawn and reconstituted, the time clock starts, and there's a limited time clock. A lot of times it's 30 minutes. So you can't pre-draw a whole bunch thinking, well, the people you're going to get in the afternoon, we'll just put it all together now. You almost have to do it each patient individually, because they're so fragile, and the time frame can be really make it lose its potency. So you also want to make sure, again, that when you get to your clinic, that you're sort of finding a space that's clean to be working with your immunizations. You don't want to set your needle down and set your diluent and stuff on a dirty table. So make sure that you have everything cleaned, that you're using good asepsis techniques when you're drawing. You're cleaning the top of all of your vials prior to. You want to do all that and make sure that we're being good. And then document. You want to document the date of administration. They need to know the manufacturer, the vaccine lot number, as well as the name, title of person. So, and again, make sure your lot and manufacturer are the same. Document which vaccine information sheet you gave, so which viz was given out. They're updated periodically. It's really important that the most updated one be the one that you give to that patient. And these records can be kept for a long time. Doses, you want to make sure some common things that can occur. You want to follow your 7 rights. You have the right patient. You're using 2 identifiers. What is your name, sir? What is your date of birth, or ma'am? Are we using the right time schedule? Vaccines given too early can cause a problem. So if you give a patient, for example, the flu can be given to ages 6 months and higher. If you give a flu shot to a 3-month-old, that's using it too early. Sometimes, too, there's a month apart. You give one vaccine, and a month later, you're to give the second dose. If you give it 2 weeks early, you're giving it out of the recommended time frame, and it could cause adverse events. You want to make sure you're doing the right dose. Is this a pediatric dose, or is this an adult dose? Make sure you know your ages. Expired, did you use an expired diluent in a non-expired vaccine? And did you make sure that you talked to the patient first and screened them so that they didn't have any allergies or any adverse effects? So you want to make sure you use all of your normal 7 rights of medication management. We don't want to deviate from that. Before attempting to administer parental injections, you must develop the necessary skills. So we're having you watch this training video. Hopefully we'll give you a lot of background information, and then we're going to give you some time at the base to work with the mannequin and practice your skills, and we'll sign you off on that as well. So you want to also know the advantages and disadvantages. You want to be able to educate the patients. You want to be able to talk to them about what is important, why we're doing parental administration, why it's not the nasal method, why this can't be taken orally. You want to know that mostly everything is absorbed when we do it parentally this way. Everything is absorbed. It's not going through the GI tract and being taken out or broken into pieces. It's going right into the bloodstream and affecting our cells, getting right there. The characteristics of the vaccine. I tell people when I'm giving them the anthrax, you're going to have redness, swelling, pain. You're going to have a lump. It can last weeks. That's normal. You want to know what those side effects are and be able to educate the patient so that they know what is normal and what is not. When you get smallpox, you might have a fever, body aches, chills. You're going to feel yucky like you have the flu. That's normal. That's just your body reacting and building up an immunity and building up those antibodies. Be aware of patients' physical and mental health conditions as well. Watching out for that. Are they struggling? Are they nervous? Are they having a hard time? You want to kind of know where they're at and what they're thinking and what their thought process is. Again, there's no way to retrieve a vaccination once it's been injected. So you want to make sure that you have covered everything with your patients prior to. So steps for administration. You want to greet people, let them know who you are, answer any questions, screen for contraindications, offer documentation, or document it yourself. You want to perform hand hygiene. You want to make sure that you are reconstituting if needed. You want to be careful about needle stick injuries. That's huge. We don't recap needles. We don't carry needles that are uncapped long distances. Make sure you have your sharps container right there handy. Make sure your sharps container is not more than 3/4 full. If it's more than 3/4 full, you need to cap that one off and get a new one. All of those things help reduce your risk of injury to yourself, injury to the patients. Know what your vaccines are supposed to look like. Know that if there's some kind of particulate or discoloration, that can happen. People have had the rubber stoppers start to disintegrate and fall into it. That's no good. And those things need to be reported. And you don't want to give that vaccine to that patient. Make sure you select your appropriate sites, you clean it good, and then administer, put on a Band-Aid if needed. Sometimes people will bleed. I think it's the chemicals or the ingredients that are in that vaccine. It could be the needles, it could be the needle size. And you want to monitor your patients throughout for any kind of adverse effects. Adverse effects or adverse reactions and emergency management. It's really important that we are aware of what's going on with our patient. You want to be watching them at all times. Some of the most frequent reactions are local reactions. Like I said, you're going to have redness, swelling, you'll have a little pain to the site, and all those things are really normal. It's just your body's way of creating a response to the immunization, building those antibodies. Then less likely to occur you could have a systemic, so syncope, but we do see that still. So people can pass out, get dizzy, lightheaded, pale. They could break out in a sweat. Those are things we see too if we're going to see a reaction. And then there's the severe and significant, and that would be an allergic reaction, full on anaphylaxis. They break out in hives, respiratory distress, maybe some wheezing, swelling. They're getting hoarse. They're kind of trying to clear their throat. Those could all be signs of anaphylaxis. So you really want to be watching your patient from the time they come in to the time you're giving them. It's a good idea to have your patients be seated or laying down during the vaccination process. Be aware of the symptoms of fainting. So I really watch patients. I listen to what they're saying. I monitor their eye movements. I watch their skin color. If they're shifting in their seats a lot, they're making comments about being nervous or how they hate immunizations. Are they avoiding eye contact with me? Are they starting to break out in a sweat? And at that point, you want to get somebody to help you. So just, in a calm voice, just call over someone to kind of come and be with you with that patient. And should they really pass out and faint, if you can get them to the floor prior to fainting, that's perfect, because you could have them lay down, raise their legs, and get that blood flow back to their core. But oftentimes, they're in the chair. In which case, if you can get them to lean forward, put their head down again, kind of shunt that blood to their brain and to their core, that's where they need it. You want to provide supportive measures and observe the patient for at least 15 minutes after the vaccination, just to make sure that they're not going to have other injuries, especially if they're really pale. You want to really watch them. And fainting can be the most common post-injection adverse event. And again, having them seated or laying down. You don't want to use a chair with wheels. Sometimes patients become very rigid, and if they're on wheels, they could slip out. It could shift or move. So don't put them in an office chair with wheels. And we want to make sure that we protect their head from any kind of injury too. So we try to keep them in the chair if possible during that time, and then get vital signs and monitor for those adverse reactions. And it can be very scary. So if you can provide any kind of seclusion or privacy, that's really important. When people get syncope or have syncopal events, they get very gray and ashen. They can break out in a sweat. They can snore. And again, the rigidity. And that can be very traumatizing to maybe family members or buddies who are there watching them. So really keep an eye on them. Now, symptoms of anaphylaxis, like I said, there's wheezing and shock and hoarseness, angioedema, so swelling, laryngeal edema, cramps. They might pass out, be disoriented. Again, if their throat is closing, they might feel like, they are trying to clear their throat. Okay. And this is also why it's the most important question you can ask them. I always ask, do you have any allergies to foods or medications? We need to know that in advance. They may think, oh, I don't have it to that vaccine. I don't have an allergic reaction, but they have an allergic reaction to eggs or gelatin, or they don't realize that those things are in the vaccine and could cause that. So you really want to make sure that you are monitoring and screening for those questions. Have you ever had a reaction? Are these people who just get themselves so worked up, they're so nervous about having a vaccination or an injection that they're so worked up? Those folks too, you want to make sure that you screen that. If they need to lay down, then let's lay them down, find a place to do it. Hopefully if you're doing these mass ones, you'll be in a church or a school or somewhere indoors, especially because of the winter. And we can offer that to those people. So then if anaphylaxis occurs, You want to make sure that you have the necessary equipment. So it's a good idea to start your day knowing where all of your equipment is, all of your supplies. Don't wait until an emergency to find out where your oxygen is, where your EpiPens are, where your go bag is. Make sure you find all those things out. Know where your temperatures are and what your temperatures and how your vaccine's being stored. Know how you're giving the vaccine, where you're giving the vaccine, how it's being administered, and know where all of your emergency equipment is. Make sure that you know where the AED is. I mean, your job might be just to get the equipment, and then the nurse and doctor are going to do everything else, but you need to know where that is so that you can help them. So make sure you know where the equipment is. Make sure there is equipment. If you get there and they say, well, we have Band-Aids, no, that won't do. You need to make sure, is EMS close by? Is an ambulance going to be on standby while we're doing this? Make sure you know all those things ahead of time. And then you want to, of course, follow your ABCs. You want to give epi if needed, monitor their circulation, their airway, their breathing, and you want to activate the EMS if needed or know what's going on. At our base, we have standing orders for these things. So we can right away, we can give epi, and we keep 3 epis, 4 epis on hand at all times. We also always have oxygen with tubing. We have suction devices. We have AEDs. We have Benadryl that we can give IM as well. So those things we have standing orders for. We have a formula for those medications and how they should be given. So in an emergency, don't be afraid. There's no contraindication to giving epinephrine if needed. Also know if you're going to assess them, you want to make sure that you know where the adult versus the child EpiPens are. So there's Epi Junior and there's the regular adult EpiPen. Know the ages and sizes and weights for the Epi Junior, or wait for guidance from a provider or a nurse on site. You want to do your rapid assessments, check for breathing, of course, mental status, have the patient lay down, avoid any kind of movement. When I have them get up and walk, just let's get them stable. Place the patient in a recumbent position. Again, elevate the legs. We want to shunt all that blood to the core. We want to give the heart and your circulatory system everything it needs to keep going. Administer that epinephrine. It goes in the thigh, in the muscle, intramuscular. You just take it out of the plastic container it's in, and you don't put your thumb on the top, just hold it down, and it can go right in. The reason you don't want to put your thumb on the top is because if you have the wrong side and that needle side, that's going to hurt your thumb. So just hold it down and go right in. You want to call the emergency management system, monitor vital signs, and start documenting all of this. You want to keep a record so that if EMS comes, you can tell them what happened, what you've done so far. Keep those good records. And talk about what vaccine they got. So again, emergency equipment, we're going to have oxygen, we're going to have tubing, non-rebreathers, nasal cannulas, we're going to have EpiPens, at least 3. We're going to have IM Benadryl, an AED, suction, vital signs, all of those things we have at our base. And when we're giving immunizations, we carry them with us. We have them at all times, and we're just always prepared. Make sure your oxygen tanks are not empty before giving them as well. If there is an adverse event, whether it's just swelling, redness, somebody passed out, they got a fever, any acute complications, they died. I mean, hopefully that won't happen. Neurological changes, all of those things you want to make sure that you document and report. And we use the vaccine adverse event reporting system to do that. Now, the military has their own VAERS report. The VA has their own VAERS report, but either way, you want to make sure, and anyone can document this, anyone can call, and if you just call the number, they'll walk you right through how to do that. It's really pretty simple. The CDC monitors this, the FDA monitors these bears, and that's what helps them to make changes. For example, when we first got the anthrax vaccine, it used to be given subcutaneously in the fat in the back of the arm. People were noticing that it was slower absorption. People weren't getting quite the effects that they wanted. And it was causing a lot of pain, discomfort. And so the side effects were really not very good. So over time, they checked it, and now we're seeing, by doing it intramuscularly, we're seeing a lot of benefits and improved outcomes from that. So that's just an example of how VAERS reporting can make a difference. Getting vaccinated is just one of the steps. So we want to make sure that people know that even if they get the vaccine, it doesn't mean that they can stop wearing the masks and social distancing and monitoring themselves and good hand hygiene. It's just one step. You still have to do all the other things. Also, if somebody's asymptomatic or had a positive exposure just prior to getting the vaccine, they might get sick. It's not from the vaccine, it's because there wasn't enough time to build up that immunity prior to them getting the vaccine. So those are things we're going to have to watch too. So that is the end. Hopefully, this will help you guys guide your way to giving it your best shot. We are going to do some practicing and training, so we're not just going to send you out there without any kind of follow-up training. But I'm confident that with this knowledge that you all are going to be great, and you're going to be able to answer questions and screen patients appropriately. So here are some references. They're also great sites to go to, and where you can look up more information if you have questions or you're curious about immunizations. So feel free to go to any of those as well.